Let's discuss the mechanism of necrosis. Necrosis is a form of cell death instigated by external factors such as injury, toxins, or insufficient blood supply, causing irreversible harm to cells. The process unfolds in several stages, beginning with an initial insult, whether physical trauma, exposure to harmful substances, ischemia, or infection. Following this, affected cells swell due to disruption in ion gradient across the membranes, leading to an influx of water and ions. As the damage progresses, the membrane integrity is compromised, resulting in the leakage of cellular contents into the surrounding tissue. Consequently, an inflammatory response is triggered, attracting immune cells to the site of injury. Within the damaged cells, various enzymes and molecules are released, including proteases, nucleases, and reactive oxygen species, further harmful surrounding tissues. This cascade of events perpetuates tissue damage and triggers repair mechanisms such as fibrosis and scar formation. Necrosis, unlike apoptosis, is typically unregulated and pathological, leading to inflammation and significant tissue damage. Now, the causes of necrosis. Necrotic tissue forms when not enough blood and the oxygen that blood carries reach the affected tissue. Blood clots and blood vessels damage are just two of the many causes that can trigger necrosis. Injuries, infections, diseases, and toxins that blocks blood flow to an area can cause necrotic tissue to form in the area. Number one is injury. Traumatic injuries can damage blood vessels and cut off blood flow to the surrounding bones and tissue areas. Anything from a car accident to falling from a ladder can result in traumatic injury that triggers necrosis. Number two is infection. A wide variety of bacterial, viral, fungal, and parasitic infections can trigger necrosis. Even a minor cut or scrap that gets infected can lead to necrosis. Some types of infection more commonly cause necrosis than other. In particular, the bacteria called group A, Streptococcus, is thought to be the most common necrotizing infection. Bacteria that can result in necrotic tissue include specimens of the genus Enterococcus, Staphylococcal aureus, and etc. Number third is diseases. Certain autoimmune diseases are known to cause necrosis, the most common of which is systemic lupus erythematosus, and it's through the people who treat their SLE with corticosteroids are most at risk, as long-term use of corticosteroids weakens bone. A number of other diseases can trigger necrosis by damaging blood vessels and blocking blood flow to bones and tissues, including alcoholism, sickle cell disease, chronic kidney failure. Number fourth is toxins. Chemical agents such as poison, venoms, and certain recreational drugs are known to trigger necrosis. Exposure to arsenic, a metal found in a rat poison, and contaminated groundwater can trigger necrosis in the kidneys. Cocaine that is laced with a white chemical called vemamisole is linked to kidney necrosis as well. Now, the symptoms of necrosis. Symptoms of necrosis vary depending on where in your body the necrotic tissue has developed. For example, symptoms of necrosis in your kidneys include back or flank pain, bloody, cloudy, or dark urine, painful urination, urinating large amount. Or when necrosis stems from a wound, symptoms can include pain that seems more severe than it should, fever, rapid heartbeat, numbness, rapidly spreading redness from the wound, pain and warmth near the wound, skin blisters, grayish, smelly, liquidy, grainy from the wound, difficulty thinking clearly. Now, the treatment. A complete blockage of blood flow is typically painful and usually painful enough to make someone seek medical help immediately. Treatment may include surgery to restore blood flow or to remove the damaged tissues, antibiotics to prevent or treat infections, or treating the burn or other tissues that cause the initial damage. Number one is removal of tissue. Removal of necrotic tissue prevents the spread of infection. Treatment could also involve the amputation of a limb. Number two is medication. Antibiotics or antifungal medicines are prescribed to fight the infection. Number 3 is hyperbaric oxygen therapy. Uses a pressurized oxygen chamber to raise the level of oxygen available to your red blood cells. This may aid in wound healing, however, the data is inconclusive. Number 4 is tetanus immunization. A tetanus shot may be recommended by your healthcare provider to protect you against additional infections.